My dear friends, today I'll be discussing about the risk factors or causes of myocardial infarction or heart attack. Now, myocardial infarction is one of the important leading cause of mortality and morbidity throughout the world. With the rising incidence of diabetes, hypertension, lipid abnormalities, obesity, the incidence of my heart attack is also rising throughout the world. Its cases are also increasing both in developing and developed countries. In countries like India also, the number of deaths are also very much high because of heart attack or myocardial infarction. Now, proper knowledge of myocardial infarction is very much important. So to start with, I must say that heart attack or myocardial infarction is because of damage to the or permanent damage to the cardiac tissue that is irreversible. So what is myocardial infarction? It is the permanent irreversible damage to cardiac tissue or cardiac muscle or heart muscle wall, and that is because of blockage in the arteries supplying the cardiac musculature. So this blockage is because of fatty plaque deposition or cholesterol deposition or fat deposition in layman's term on the inner lining of the coronary artery, which causes gradual narrowing of the artery, and with time this atherosclerotic changes or fatty plaques can rupture and finally form thrombus or blood clots, which can block permanently any vasculature supplying some part of heart, that is coronary arteries. So because of body blocking of some coronary artery, the heart muscle cannot get blood flow or cannot get blood supply. So heart muscle, because of lack of oxygen and lack of nutrition and lack of blood flow, it dies and undergoes permanent damage. So that is called myocardial infarction. So there are many risk factors which are responsible for myocardial infarction, and today we will try to discuss all these risk factors. So number one risk factor is older age. Now with age, the cardiac efficiency also decreases. At the same time, with age, as the person grow elder or gradually becomes old, there is increase in the atherosclerotic changes or deposition of fat on the coronary arteries, and because of this the person become more prone to develop myocardial infarction in future. Now atherosclerosis or deposition of cholesterol or fatty plaques on the arterial wall, inner arterial wall, causing narrowingness of the artery. There is no sign symptom for atherosclerosis, so it occurs very silently and ultimately it can lead to myocardial infarction or sudden myocardial ischemia and heart attack. So older age or old age is one of the important risk factor, but it is unpreventable risk factor which we cannot prevent it because it is age cannot be reversible. So it is a risk factor. By doing regular exercise and proper dietary changes, we can control the risk of getting myocardial infarction as the age advances. Next comes the another important risk factor, that is smoking. Smoking is very injurious to health, all of you know. It is responsible for increasing the blood coagulable mechanism or blood clotting mechanism. It is also responsible for thrombus formation. It is also responsible for platelet aggregation. It is also responsible for hypertension, which is another important risk factor for myocardial infarction. So smoking is responsible for myocardial infarction or heart attack by various mechanisms. Next important risk factor is hypertension. Now hypertension means high BP, and normally blood pressure should be less than 120 by 80, but if it is more than 140 by 90, there is more than 140 that is systolic and more than 90 that is diastolic, then we call it hypertension. It should be treated very seriously because otherwise it may leads to myocardial infarction also. So untreated hypertension is also one of the cause of myocardial infarction as well as stroke in various age groups. Then another important risk factor is diabetes mellitus. Now diabetes mellitus is a metabolic syndrome which is because of insulin deficiency as well as insulin resistance, but because of metabolic syndrome it is associated with various microvascular or macrovascular complication. It is associated with hypercholesterolemia, it increases the blood pressure level, it also weakens the heart, and because of all this mechanism it increases the risk of myocardial infarction. So diabetes is another important risk factor for development of myocardial infarction. Next one is high cholesterol level. Now cholesterol is a substance, is a wax-like substance which has a tendency to be deposited in the inner wall of the arteries. And this cholesterol is carried by some protein known as lipoproteins. There are two types, one is LDL and HDL. LDL is low density lipoprotein and HDL is high density lipoprotein. Now HDL is responsible for removal of the cholesterol from the inner lining of arteries. So it prevents the deposition of cholesterol on the arteries, or it prevents atherosclerosis. Whereas LDL promotes atherosclerosis. So high level of LDL is not good for heart, or it is bad for heart, as it causes coronary atherosclerosis. Whereas high level of HDL is responsible for prevention of atherosclerosis. So that's why it is always advisable to lower the cholesterol level, to increase the HDL and lowers the LDL so as to prevent the cholesterol or bad effect of cholesterol on the heart, because it leads to coronary atherosclerosis, which leads to coronary artery disease, and which is an important risk factor for development of myocardial infarction. Next important risk factor is coronary artery disease. So coronary artery disease may be because of gradual deposition of fats or fatty plaques or cholesterol on the inner lining of coronary arteries, and because of this, or because of coronary atherosclerosis, there is a risk of ischemia, sometimes angina may be caused, and even it leads to cardiac infarction or myocardial infarction or heart attack. So we should treat coronary artery disease very seriously. We should try to remove the plaques by doing various cardiac intervention, or we should go for taking therapeutic management like taking statins, controlling blood sugar level, controlling blood pressure, etc., so as to prevent the risk of development of heart attack from coronary artery disease. Next important risk factor is low physical exercise. Now physical exercise or regular physical exercise is very much important for our human body. It is responsible for normalizing our blood pressure, it is responsible for lowering our cholesterol level, it is also responsible for prevention of myocardial infarction. So those persons who are not doing regular exercise, physical exercise, or enjoying a sedentary lifestyle or lack of physical activity, it increases the risk of myocardial infarction. Next comes the obesity. Obesity constitutes 20% of the myocardial infarction. Obesity is associated with hypercholesterolemia, it is associated with hypertension, diabetes, which ultimately leads to myocardial infarction. So we should try to our best so as to keep the obesity in, or cut down the obesity, or to prevent obesity by weight loss program, by regular exercise, by dietary restriction, and so on. Even for morbid obesity, then bariatric surgeries are there, even medications are there so as to control obesity. Morbid obesity, or whose BMI is more than 40, are at higher prone to develop myocardial infarction, because because of their high body weight and high fat content, their heart is at higher stress because of because their load is very much high for heart, and that's why the risk of myocardial infarction is very much increased. Besides, those who have family history of myocardial infarction, they can also have myocardial infarction. So family history is another important risk factor which we cannot prevent also. So it is not a unmodifiable risk factors. Besides, high level of triglycerides is another important risk factor. Triglyceride is also a type of fat. High level of triglyceride can also lead to myocardial infarction. Besides, tobacco smoking in any form, tobacco intake or smoking in any form of tobacco products can also increase the risk of myocardial infarction. Stress is another important risk factor. Stress is responsible for secretion of hormone known as cortisol, that is responsible for various cardiovascular changes. It is responsible for rise of blood pressure. It is responsible for atherosclerosis. It is responsible for lipid peroxidation, and all those things ultimately leads to increased risk of myocardial infarction or coronary artery disease. Then next comes another important risk factor, that is poor diet or unhealthy diet. So diet which is rich in saturated fat, diet which is rich in cholesterol, diet which is rich in trans fat, animal fat, low fruits and vegetables, low vitamins ultimately increase the risk of myocardial infarction. So we should always give importance to low saturated fat, low trans fat, diet full of fruits and vegetables, etc., so as to prevent the myocardial infarction. Besides, genetics is also plays important role. It has been found then that chromosome 21 may be associated with chromosome 9 may be associated with, and locus 21 may be associated with myocardial infarction. So some mutation in the chromosome 9 and locus P21 may be associated with myocardial infarction, increased risk. Besides, it has been found that CDKN2A and 2B gene is a gene which is associated with increased risk of myocardial infarction. So those person or those patients who are having mutation in this gene or activated form of this gene may ultimately have high risk of development of myocardial infarction in future. So family history may be because of the expression of this gene. Beside, another important thing I should say that diurnal variation is another important factor. Diurnal variation. So it has been found that myocardial infarction is very much common in early morning. That is because of high level of hormones are there at the early morning. So because of high level of secretion of hormones, so chance of high pressure is very much increased during early morning. So increased risk of myocardial infarction is very common in early morning. So diurnal variation is another important risk factors. Again, for those who are working in night shift or shift workers, they are at higher risk for development of myocardial infarction because those who are working in night shift, they have lack of sleep. So lack of sleep leads to internal stress, which ultimately leads to rise of blood pressure, various cardiovascular changes, coronary artery disease, hypercholesterolemia, and which finally leads to myocardial infarction. Besides, women who are on oral contraceptive pill, they are also at higher risk of development of myocardial infarction. So OCP is actually is taken by oral contraceptive pills. Mostly women take during the reproductive age group so as to prevent unnatural pregnancies or unwanted pregnancies. But it increases the risk of breast cancer. It increases the risk of coagulability or blood clot formation, which ultimately increases the risk of myocardial infarction or heart attack. Besides, high myocardial infarction has been associated with endometriosis. It's a gynecological problem which occurs less than 40 years. So endometriosis less than 40 years is another important risk factors because it has been found that this endometriosis may be associated with high risk of myocardial infarction. Besides, air pollution. Now, those who are people who are staying in very polluted atmosphere or polluted area or cities which is highly polluted, containing the air containing carbon monoxide, then nitrous oxide, then sulfur dioxide, then are responsible for increasing risk of myocardial infarction, even heart attack. But ozone is not responsible because ozone does not contribute to myocardial infarction. So carbon monoxide, nitrous oxide, nitrogen dioxide, sulfur dioxide, so these are various gases which is responsible for air pollution, and they also increase the risk of myocardial infarction. Besides, some infections, maybe virus or bacterial, also increase the risk of myocardial infarction, and out of these the most common is chlamydia pneumonia infection. So chlamydia infection also leads to myocardial infarction. Besides, infection by bacteria like H influenza, it is responsible for influenza. Beside Helicobacter pylori and Pseudomonas gingivitis. Gingivitis is another infection, bacterial infection, which may leads to increased risk of myocardial infarction. So chlamydia infection, then influenza infection, then Helicobacter pylori infection increase the risk of myocardial infarction. Helicobacter pylori increase the risk of hepatocellular cancer. It also increase the risk of GI cancer, peptic ulcer, gastric carcinoma, and at the same time it also increase the risk of lymphoma. Besides all these gastric problems, it also increase the risk of myocardial infarction. It has been found that in some study that Kawasaki disease is a disease which is also associated with myocardial infarction. So those patients who are suffering from Kawasaki disease, they should be intervened in right moment and diagnosed at right moment so as to prevent the risk of myocardial infarction. Besides, high homocysteine level is also associated with increased atherosclerosis or increased risk of atherosclerosis and also increased risk of coagulation of blood, which ultimately leads to myocardial infarction or heart attack. Besides, some coronary arterial disease like coronary artery dissection or coronary spasm may be at increased risk for development of heart attack or myocardial infarction. So my dear friends, these are the various risk factors or causes of myocardial infarction, and proper knowledge of risk factors as well as proper etiology of risk factors can be very much important. Yes, if you know the risk factors and if you know the preventable risk factors, we can intervene them in right moment. We can stop these risk factors or cut down the risk factors so as to prevent the risk of getting heart attack or myocardial infarction in future. So this is the importance of knowing the various risk factors, because therapeutic strategy or management of a disease or secondary prevention of a disease also based on knowledge of the risk factors, and cutting down of the or cutting or decreasing this exposure of these risk factors can decrease the risk of getting myocardial infarction or heart attack in future. Thank you very much.